All right, good afternoon, everyone. Thanks so much for joining us. Welcome to our first webinar in a series of three focused on rural health. Today, we're going to hear from a couple of presenters with the AHEC program and learn about the workforce development that they're doing across. They're focused on in West Central Illinois, but it's happening across the state. First, a few housekeeping things. If you did not register, if you didn't register yourself for the webinar, please put your email address in the chat and we'll make sure you get a link to today's recording and the resources. This webinar is being co-hosted by University of Illinois Extension and Rural Partners. Rural Partners appreciates working with the University of Illinois Extension on this webinar series that we offer throughout the year. Rural Partners, if you're not aware, is the state's Rural Development Council. We are a volunteer working board, and membership driven. So if you have an interest in learning more about being part of our organization, we will include a link to our website in the chat so you can check us out. And again, Rural Partners wants to thank U of I Extension for working with us and partnering with us on this webinar. Again, we're going to hear from Mary Jane Clark and Rachel Benn today with the AHEC program in West Central Illinois. And they may have a more specific term than that, but that's what I call them in West Central Illinois. Is that correct, Mary Jane? Or is there?
That's what I'm through, and then Rachel's through Central Illinois.
Perfect. No. Thank you. Okay. So we'll hear from them. If you have questions, please enter those into the chat throughout the presentation, and we'll get to those at the end. We're excited for Rachel and Mary Jane, to join us, and I'm going to hand it over to them. Thank you.
Thank you so much. We appreciate the opportunity to talk today about what we do in AHEC, and AHEC stands for the Area Health Education Center. And so we're going to be talking about from classroom to clinic, AHEC's integrative approach. We are out there in the communities and we want to identify ways that we can partner to continue to do the work that we're doing within the regions. And so I am Mary Jane Clark. I am at the West Central Illinois Area Health Education Center, and my colleague Rachel Benn is with us. She is with the Central AHEC in Bloomington at ISU. Make sure I get all this right too, Laura.
Yep.
And so we're going to be chatting today about just a little bit about what we do and how maybe we can partner throughout the presentation. So I'm going to turn it over to Rachel.
Perfect. So just quickly, the kind of objectives that we have for our presentation today is we hope that by the end of the presentation, you all will be able to describe the Illinois AHEC network and some of the things that we do, list some of the programs that we have through our network across the state, and also explain the benefits of collaboration with the Illinois AHEC network. So to start off, we're going to talk a little bit about what the Illinois AHEC network is. I always love, as a newer director, being the one given this task. It's kind of like my final exam. Do I know what I'm talking about now, a year in? So the Illinois AHEC network, the kind of overall mission of the Illinois AHEC network is to improve the supply, distribution, and quality of healthcare professionals in Illinois. So AHEC, just kind of moving back to like the federal side of things, AHEC is actually a national program. It's a federal grant through the Human Resources and Services Administration that was really designed to be able to kind of saw a need for greater healthcare access in rural and underserved communities, greater access to quality healthcare professionals in those areas as well. So on the state level, our kind of overall goal is to work to improve that supply, distribution, and quality of healthcare professionals across Illinois in those rural and underserved communities. So we do this through a number of different ways, but kind of our main focuses are promoting healthcare careers to students. So working with high school students and helping them learn about what all the different careers in healthcare are, what exists, giving them different opportunities to explore those healthcare careers. And then enriching the learning environments for current students. So for students who are already in a health profession program, what are ways that we can provide more opportunities for them to further develop their skills, further develop their knowledge, help them feel prepared once they got into the workforce. And then also providing professional development opportunities for individuals who are already in the fields of their choice as well in healthcare. So in Illinois, we have 9 different AHEC centers. Mary Jane works at the West Central AHEC Center at Carthage Memorial Hospital. Like she said, I'm at ISU in Central Illinois. So I cover 16 counties. I think Mary Jane covers around that as well.
17.
17? 17, yeah, close. Yeah. So we have 7 like regional centers, and then we also have 2 in Chicago. Our centers are housed at different locations kind of strategically. So most of our centers are housed at either rural hospitals or critical access hospitals. But we also have like mine at ISU. We have Northern Illinois University as a host site. We have a couple nonprofits in Chicago. And kind of the purpose for being at different locations is so that we're able to kind of use the strategic partnerships of different types of organizations to do the work that we do. So our centers who are at hospitals have more access to providing opportunities for students at their hospitals, where at ISU, I have a little bit more opportunity to connect with students, provide more of the mentorship aspect for students, provide different student opportunities at the college level. And then we work collaboratively together to kind of create different programs and work together to kind of reach some of the goals that we have for our Illinois AHEC network. So when it comes to supporting the rural healthcare workforce and trying to develop the rural healthcare workforce, some of the recommended ways to educate and train the rural healthcare workforce are growing your own and career ladder programs. So providing opportunities for students and people coming out of your communities to be able to get the education that they want, get the opportunities that they want, to be able to then go back and work in their communities, to become doctors in their communities, to become public health leaders in their communities, to become technicians in their communities and give back to the communities that they grew up in. So that can look like job shadowing, career fairs, different kind of like scrub exposure experiences for students, employee apprenticeships, and career development programs as well. Another recommendation is to improve the rural education and training. So really looking at what are the needs in our communities for education. We've heard a lot that there's a lot of need for respiratory therapists right now. So we kind of bring that information back to our communities and let like our community colleges know, hey, there's a real need for this. Could you develop this kind of program? So kind of making sure we're bridging those gaps between the need and then the education that's available in the communities as well. That can also look like rural rotations for students who are in residencies, making sure that they get the opportunity to go work in rural communities, whether they are from those rural communities, whether they are interested in going to work in a rural community, whether they just want to learn more about what it's like to work in a rural area. That's an important piece of the rural education and training as well as providing continued education for our physicians, our nurses, our practitioners who work in those communities. And making sure that they have access to continuously learn and educate and train themselves as well. And then along the technology route, making sure that rural communities have the access to the technology that they need for distance learning, for telehealth, for different things like that as well, to make sure that we're able to provide the best care for our rural communities. So this is kind of our why is this important for all of you to know? So we know that when it comes to economic benefits of having good rural healthcare in our rural communities, providers who are more likely to practice where they complete their residency. So having opportunities for providers to complete their residencies in rural communities that they're from or that they're interested in working in increases the likelihood that they're going to go back and work in those communities. And hospitals are often one of the largest employers in rural areas, and then access to good healthcare is the #2 priority for firms deciding to relocate or expand into a community. So having quality healthcare professionals, having opportunities for quality healthcare professionals to come work in the community, growing your own and making sure that those good students who are really interested in going into healthcare are able to come back and work in your community, making sure they have the opportunities to job shadow and do different experiences within the community so that they want to come back and then grow the community from there. I know, Mary Jane, we talked a little bit about this the other day, so I don't know if you wanted to add anything into this.
Well, and we have a conversation going on in the chat as well about why should a young doctor want to work in a small town? And what we found is the grow your own model through AHEC that's been around since 1972 is working. Physicians are more likely to go back to a community where they were from or similar to where they were from and where they complete residency. So if they go into a rural residency program, they're more likely to go into a rural area. If they are connected to a community in the sense of family, friends, some of them want to live close to that area when they finish. And so providing opportunities within those areas for them to complete training is extremely important along their path. And having hospitals and clinics willing to have those students come in is extremely important in that career trajectory and getting them to come back. Because if they see that there's opportunities for them, that then helps them think of being there when they are finished. So again, that whole pipeline where it's not too early to start working with some of these students who are interested in giving them opportunities is a huge benefit to having them then return. There was another question in about loan forgiveness, and there's a national loan forgiveness program. There's also a state forgiveness program. You can't be in both at the same time, but it does help students understand if they know those resources are out there, that the place that they might be considering coming back to has an opportunity to benefit from those programs so that they're not worried about finances. We're finding a lot with this next generation. We're seeing a lot of, well, I don't want to be in school that long, or I don't think I have the money to do that. I'm really concerned about how much this is going to impact me financially. And so again, helping them think through that is really important in getting them to return. I was just talking to pre-med students last night. And so as I'm talking to them, their ears perked up when they started thinking about the loan forgiveness program. And in fact, one of them was like, oh, well, my brother's a dentist. And so, he already works in a federally qualified health center. So if he's already there, can he qualify for National Health Service Loan Corps repayment? So we want to make sure they understand that there's opportunities out there. So then it will allow them to go back to a rural community. That's what I saw in the chat so far. So again, we want to make sure that students understand that there's benefits there. There's benefits for behavioral health. There's opportunities for pharmacists, for physicians, nurse practitioners, PAs. And so that information is out there and very much attractive to our rural kids who are looking at how much it's going to cost to go to school. So I think that that's a real benefit for us, for students going into those careers. Okay, so I'm going to talk a little bit about just what the Illinois AHEC programs offer. I've been working with AHEC for a really long time before I was a center director. And so this is a great way for us to get out there and explore all the things. Most of the time when I talk to students, if you talk about health careers, they think of doctors and nurses, but there's so many more health careers out there that we use within the healthcare system in the healthcare setting. And just like Rachel was talking about respiratory therapy, some of the students don't really think that way. And so the more we can expose them to these various programs, the better. And so within AHEC, we offer a rural health experience so they can come and learn what we do in rural, all the different areas of health professionals that we offer. As sometimes we're working with public health as well. So when our students come, they spend a half a day at public health. They spend sometimes a day in our federally qualified health center in Henderson County. So they see a little bit about rural, and so it's a rural immersion experience. They shadow in various occupations. Sometimes it's because we decide those are who we want them to talk to. And sometimes it's preference. I really want to shadow a physician in a family practice and see what they do. And so they often meet with our administrative team. My CEO, you're going to see a note from her at the end of the presentation, but she loves students and believes that we should be training that next generation of healthcare professionals. And so we have students in our facility all the time. I work at a critical access hospital, and last year we did over 12,000 hours of student time within our facility alone. So having students is something that hospitals and health departments really need to be invested in to get kids interested in those careers. Go ahead and move on to the next thing there, Rachel. So this is just a little bit about what the students' requirements are and what the healthcare organization requirements or who we partner with in order to do this. I have 2 hospitals in my region that will allow for rural health experiences. We'd love to expand this to other areas. And so I know Rachel is located at a university, and so she has to rely on partners in order to do this, but there's funding available in order to be able to partner with that to host those. Along with this, part of the issue for some of the programming and getting students into some of our areas is housing. And so as an economic development, thinking about, are there short-term rental places? Are there ways that we have even rental houses for somebody coming in that's new? So there's a lot of things at play, but sometimes we can't offer experiences to students because we don't have short-term housing options. So again, sometimes we partner with a university to offer those housing options within our community. And just kind of thinking through this, we're looking for college students for this experience. And then we try to help them understand the benefits of rural, but also this is helpful for even if they are from an urban area to understand the differences in healthcare from urban and rural, and that we are providing quality care in rural areas. So again, when we partner with an agency, we help collaborate, we recruit the students, we provide the guidance that goes with this. We also provide the cost of housing and some of the meals that are related to their travel. And so that's based on center to center, but if you're coordinating and collaborating with us, we go through all of that in the beginning. And then participating partners who might want to collaborate, they will actually put the schedule together. So we're not telling you you have to have that student in this area or this area, you know, and some of our health departments would be interested in this as well. So if you have good relationships there, that may be an opportunity as well. And then we look at host sites to help with coordinating where should our students stay, where's the best option for that, and to help maybe coordinate meals. Our students eat free in our cafeteria. We have a chef, and so she's fantastic, and our food is delicious, and so they don't need to go anywhere else for lunch, but then we try to put them in local places for dinner opportunities and let them know what resources are in town. And so that's a benefit economically as well. Go ahead and move to the next slide. We also have 2 sites within the state that offer this 6-week rural interprofessional preceptorship program. This is during their summer, and it's a full-time immersion experience. They actually stay there. We're looking for more sites throughout the state, but they coordinate individuals going out, learning about other health professions. They get a $1,500 stipend to participate in this and get housing. So it really is a great professional experience. It looks great on a resume if you're applying for a rural program in your future. For med school, it shows that you're willing to go above and beyond and do some of those exciting things to learn more about the professions and to have a clearer picture of why you're going into the specific position that you are going into or interested in. Go ahead, Rachel. So a little bit about the students. They're juniors or seniors, undergraduate health majors, or graduate students in health majors. And then the preference is that they are students from rural communities. So we want to make sure that for the 6-week rural preceptorship, that they are from a rural town. And sometimes it's just getting the word out that these opportunities are available. So if you have this is already closed for this year. The application deadline has already passed, but usually this comes out in January. And so sometimes students aren't thinking about summer opportunities that far in advance. And so sometimes it's just getting those kids that maybe you know in your region or your area involved and applications in early. So some of the kind of healthcare organizations that they visit are hospitals, federally qualified health centers, health departments, rural health clinics, rural mental health clinics. They also look at the needs of the region and develop a community service learning project. That was on the previous slide, but really so that they can understand how data and some of the things like census data plays into some of the decisions that we make in healthcare. And a little bit about these experiences. There's an orientation process that they go through. The facility where they're hosted actually helps pay for this. And then the participating partners just allow for shadowing experiences. So we try to get all of those coordinated ahead of time and kind of understand what they need from their perspective. Because in the world we live in HIPAA compliance and all those things, we have to make sure we have all the paperwork in place that all of those organizations need in order to move forward. Okay, go ahead and move forward, Rachel. The other thing we do is job shadowing. We had a panel 2 weeks ago with the Illinois Rural Health Association, and the students, the individuals who were presenting on their experience encouraged every student to job shadow. And so part of what we encourage students to do is to go shadow in the career that they're in. I have a lot of students who want to go into physical therapy. And while that's great, and we encourage them to go into physical therapy or occupational therapy or whatever, go spend a day with them and see what they do. Because a lot of them choose that because they've had a sports injury and they're going to see the physical therapist and they really connected with them. And then that's what they want to do. But they don't see the other patients that physical therapists work with. So we encourage them to job shadow and really get to understand a little bit more about the career they're choosing, not just for the financial benefit of that career, not just for a glimpse in what maybe they have seen of that profession, but really to understand what those professionals do on a daily basis. And again, we recruit students. So if there are partnering organizations who are interested in talking with us about having students in their area, we would love to hear from you because that is an opportunity for anyone to showcase what they do on a daily basis. And so really, we are recruiting students. I have more students than I have space for sometimes coming through my doors. And so especially when it's related to behavioral health. So if you have behavioral health teams or other teams within your community, if there's opportunities for students in those, we would love to hear about that as well, because that is going to give students the best shadowing experience.
I will say too, just in my region, being at a university and like having more access to the students, I am always looking for in Central Illinois more partners for shadowing. I have a ton of students who are interested in shadowing opportunities, even in McLean County, but there's a little bit, since we have, we've got Advocate Broman or Carl Broman now, and OSF, and sometimes they're just a little bit trickier to get into for shadowing opportunities. So I'm always looking for like smaller clinics or just other opportunities, FQHCs, different organizations that will let students shadow. So that's just like a specific call out for me, because I know I'm always looking for more partners in my region for that. Okay, I will jump into our AHEC Scholars Program. So this is kind of our premier program for students. It is a 2-year program for students who are committed to improving healthcare in rural and underserved communities. So we're really looking for those students who are really eager to kind of get a more well-rounded idea of the healthcare system. It's really about trying to close the gap between students who are coming out of school and preparing them to be workforce ready once they get into their field as well. So the program consists of 2 years of online learning modules that cover the program's different core topics. They complete 40 hours each year of community-based experiential learning activities, whether that is job shadowing, whether that's an RHE, whether that's volunteering, whether that's developing different skills, attending different trainings, professional development opportunities, things like that. They also, similar to the 6-week preceptorship, at the end of their time in the AHEC Scholars Program, they complete a community service learning project where they are working with other scholars to identify a health issue in their communities to try to address and create some type of intervention for. And then we also provide the students with a yearly summer institute. So we spend time with them each summer doing different trainings, providing them with different opportunities to get certifications, develop different skills, again, to try to kind of reduce the gap between them coming out of school and being workforce ready once they enter the field. Depending on the center, some of the centers will offer stipends for their AHEC scholars that can go towards professional development opportunities, certification exams, different things like that. A lot of the opportunities that we offer through AHEC Scholars are opportunities for students to put certifications and different opportunities on their resume. Students also receive graduation cords and a certificate when they graduate from the program, and just have a lot of different opportunities for networking, mentoring, and professional development opportunities as well. So these are some of the core topics that we go through, that the students do the modules with, that we kind of focus on for our experiential learning. Again, we're really focusing on just trying to prepare students to be as well-rounded when they go out into the field as possible. So sometimes maybe if you are a nurse and you're only kind of working with nurses, you don't yet know how to do the more interprofessional piece of it. How do you work with doctors? How do you work with professionals in other fields as well? So trying to just develop their skills, develop their knowledge base, develop the tools that they have for what they're going out into the field to be prepared, to feel like they have a well-rounded idea of the healthcare system. What are things that impact a person's health if they're struggling with food access and they're struggling with housing and they're struggling with different things like that? Are they going to be able to access the healthcare system in the same way that somebody who isn't struggling with those things? So again, just trying to help them be well-rounded once they enter the field. We, through our grants, have like pre-approved programs that are allowed within the AHEC Scholars Program. So these are the ones that we currently have pre-approval for that can apply to be part of our program. But one of the good things is that we do have flexibility in this as well. If we see in our regions a real need for a specific healthcare area to be included in our AHEC Scholars Program, we can also request additional approval for those programs as well. So again, these are kind of the ones that were provided to us through HRSA, through the our grant funder, but we are able to have a little bit of flexibility in this too. So this is just a little quote from one of my former AHEC scholars. He finished the program up last December, really enjoyed kind of the exposure to different organizations and volunteer experiences. He was a pre-med student who I think the AHEC Scholars Program really helped him get into his PT program that he's going to start in May. So I think it's just a really good opportunity for students to be able to further develop their skills, advance themselves, put something else on their resume, show that they were committed to just learning about healthcare in general, and not just kind of going specifically into their field, but making sure that they have a good idea of the healthcare system in general. So another piece of AHEC is our continuing education, both that we offer as an AHEC center and the way that we're able to partner with others as well. So our AHEC network, any of our directors can assist with curriculum development, program marketing, program planning and implementation and evaluation. And we're also able to provide nursing and CHWC continuing education credits as well. One of the nice things about our AHEC network is that across the state, like my background is public health, we have a bunch of nurses who are our directors, or we have someone in social work. So we have a lot of different backgrounds within our pool of directors as well, which I think makes it really nice for the way that we can help with kind of the curriculum development, the program marketing, program planning. We all kind of have different experiences and can be helpful for those in different ways. Some of the continuing education examples from this year, we tried different centers provide mental health first aid training. I know Mary Jane, a couple of her, the continuing education programs they offered this year had to do with advanced directives, talking to their primary care providers about anxiety and depression, substance use disorders. One of our directors was able to secure a grant to offer diabetes education to primary care providers, different things like training around dementia, CPR training, opioid education. So, and that can also come through other funding as well, not just our AHEC funding. So a lot of opportunities to really look at what is needed in our communities as well and kind of address those needs through the continuing education process.
I would also say that we also can be a partner on a grant. So sometimes that's something, sometimes I'm writing a letter of support for some of the communities that I'm working with on something that they're moving forward with. And I work with my local ROSC, recovery-oriented systems of care. And so it kind of depends on what your needs are in your community and how we can partner. And that, to me, is a benefit for overall community development. And when we're talking about continuing education credits, CHWC is Certified Health Education Specialist. We're also seeing this out in the community for those who have a certification or who are offering health coaching. So there's a certification along with that. And so that also provides an opportunity there. Along those lines, the state has been working on a community health worker certification program. But I started with ICANN, AHEC, and we developed a rural health coach training program. We've had this curriculum audited, and we're working to put together some community health worker training, but we also offer the mental health first aid professional coach advocate training as part of that, but we can use that for upskilling of community health workers. If you know of them in your community, maybe you don't know what a community health worker is. It's a new and emerging healthcare field. And so this is really one of those things that has been around for a long time. Community health workers have been around for about 20 years, but really to help meet the community's needs. So if you have diversity populations within your pockets of diversity, this can be a really important opportunity. We have a bilingual patient navigator here in our area that is helping with that programming. And community health workers is the broad topic, but they can fall into a lot of different buckets. So the American Public Health Association has this great expansive definition of what a community health worker is. And so that includes things like patient navigators, peer support specialists, and Medicare is starting to recognize this. So this will become a reimbursable service. And that's why they're pushing states to develop something along this lines. So in the past, like social work students who didn't have a master's degree couldn't bill for services, but there may be opportunities under like this community health worker umbrella in order to bill for some of those services. So we're seeing this as a potential opportunity and how AHEC can be a partner with communities in order to provide some of this or to provide some of the opportunities like mental health first aid. And we've had the rural health coach program going. We started dabbling with it, I think, in 2014 and have really just built it along the way. And I partnered with Western Illinois University to start this when I was with the Illinois Critical Access Hospital Network, but really as a way to get students clinical time out in the field. But then we're also seeing it now that people from that community can be a part of a volunteer project where they're actually helping meet needs. And you may have people in your community who are already doing this. And so we just had a training last week to help all the AHEC centers be able to do this and help with this type of programming. So if this is something of interest, we can certainly have a discussion about this. So some of the other exciting and fun things that I know I've done with Laura is some summer camps. We've done some things for hands-on experiences for, 16 weeks or 4 weeks during the summer or once a day. So some of them look a little bit different, but if you're interested in hosting anything like that or putting something together with your people in your area, AHEC would love to be a part of any kind of exposure that you might have, whether it's a summer camp or a day camp or coming for the day, to let them know the resources that we have through AHEC. We can definitely help. A lot of us have hands-on resources. So we have escape boxes, we have laparoscopic instruments, we have suturing. So a lot of fun hands-on things that we can bring to students as we're going through what you can do in healthcare. So sometimes it's good to let them have some hands-on activities in between listening to professionals. So if we can partner on that, that's obviously something that we have access to, and we're a free resource. So we might as well partner up and do some of these fun things together. But we also help with career planning. So if you know of kids that need some help, don't quite have someone in the family that they can talk to on how to navigate the health career system, we are certainly here to help with that. Maybe they're shy, they're not going to go shadow anywhere. We have a virtual job shadowing platform that we can sign students up, and I'm actually the contact for that. So my contact information is at the end of the PowerPoint. So if you know somebody that would like to do some virtual job shadowing, they can get on and see all kinds of different things that they can do in the healthcare world or other industries as well.
Okay, awesome. So we've talked a little bit about what AHEC is and what some of our programs are. So what are some other opportunities to partner with Illinois AHEC currently? So just a little overview, AHEC by the numbers. Last year, we had a total of 276 activities with 4,241 participants. Mary Jane, this is statewide? Do you remember? Okay, perfect. That's what I was thinking. We have 123 AHEC scholars currently in our program, and we had 50 practicum and field placement students. So I know we have a bunch of new directors, and we're all very excited about continuing to watch our program grow and develop and partner more with all of you and find ways to provide other opportunities for students to participate in different activities, job shadowing, experiential learning activities. I think one of the best things about our Illinois AHEC network is that we do have a lot of flexibility to offer different programs that fit our region's needs. So again, being at a university, I have a little bit more access to students and being able to build programs for that college student population, provide some more of the mentorship and student support. We just recently, within the Department of Health Sciences, launched a mentorship program for our online MPH students to try to do a better job of connecting them with professionals in the field when it can be really challenging to do that when you're in an online program. So we're able to provide a lot of different flexibility to meet the needs of the centers that we're at, the host sites we're at, and also the communities that we're in as well. A couple of our centers have lending libraries. They have things that can be checked, like learning activities and learning models that can be checked out from their centers. A lot of us do career exploration programs for high school students, like Mary Jane was saying, with those escape boxes, different simulation activities, different things like that. So there is a lot of opportunity to partner with those in our regions who are also doing the work to try to expand healthcare resources and needs to our communities.
Sorry, I'm answering chat stuff too. Lots of good questions and stuff in the chat box for sure. So we have contact information for all of our center directors at the end of the presentation. So if you've identified a director that you want to connect with, we will certainly leave those slides up, and they will be available as well after the presentation so you can contact them. But really, we want to develop partnerships throughout our regions. And so really any facilitation that we can have, sometimes it's difficult to connect with people by email because we get so many emails on a regular basis. And so sometimes having a personal connection with someone makes that partnership go a whole lot faster. So if there are ways that we can partner, we certainly would be willing to do that. We are willing to connect with students, with professionals, with communities. You know, part of our mission is to promote and collaborate on population health. And so if there's opportunities for us to partner within the region, especially with high priority health goals, we certainly are willing to partner. This is one of our rural health experience groups that was at Graham Hospital in the photo there. So we have a partnership with them to offer that in Fulton County. And so we had 6 students that did rural health experiences at Graham Hospital. So again, we're willing to, even if we are located at one hospital, we are willing to branch out and work with other hospitals in order to provide the experiences for students. I had a question in there about opportunities for dental hygiene, and I will get some clarification on that so I can better answer your question as we move through this. Go ahead. So this is my lovely CEO, Ada Bear, and she loves having students in our facility, and she really believes that AHEC has opened the door for immense opportunities within our region. She says this is a huge opportunity for organizations like our hospital to expose great talent to consider serving rural communities, along with what those opportunities are and what the rewards can be to serving rural areas. This partnership helps us improve the care and resources that we can provide our community. And during a time when resources are scarce, this is a huge benefit. AHEC helps to bridge regional partnerships. Memorial Hospital considers it a privilege to be the host site for West Central Illinois. Our local AHEC office has increased the number of students that we host, and this benefits not only the students, but the staff who are challenged to be mentors. AHEC is helping to make us a better and stronger organization. So it is a fantastic opportunity to have students, because it makes you think about what you're doing and why you're doing it. Because students ask a lot of questions. And so my CEO thinks this makes us better at what we do every day, having new minds. Sometimes they see things differently. Sometimes we can ask them questions, like some of the questions in the chat. What are you looking for when you get out of med school? You know, what kind of area would you be looking at going back? So if you have people within your community who are doing these things, they're often a resource as well on finding out information. What are they looking for when they get out of school? And so this can be an exciting opportunity. We were able to partner with, we have 2 schools that we're doing health career clubs with. And so that has been a really exciting opportunity. But we have 35 kids interested in health careers and different ones. And so we need those kids to go to school and return. And so how do we help them do that, or how do we keep them in the region? And so that is a huge undertaking, I think, is to keep them here. And so someone asked in the chat, what keeps them in an area? Well, having opportunities, giving back, them seeing the connectedness of a community, how they fit into that connected community, all of those things can help identifying that they can stay local, that there are schools in the region where they can go. They don't have to go all the way across the country in order to necessarily get that degree. Showing them what jobs are in their area is also a huge benefit for students. Okay, so again, we are interested in connecting. Teresa Strum is at Northwest AHEC. She covers the top areas of the state. Dr. Giselle Navarro is at Northeast AHEC at Northern Illinois University. You guys have all met me. This is my contact information. And then on the next slide, which will all be coming out, Rachel. And then Rafael Corona is at East Central AHEC. So someone in the chat mentioned Gibson. And then South Central down in Pinckneyville, that would be Gloria Shigoda. And then Heather Greenwood is our Southeast AHEC in Wabash General Hospital. So every county in the state of Illinois has an AHEC center that is covering it. And so we would encourage you to partner with us. If you don't know how to partner with us, we'd be happy to have a conversation with you or your community, or whoever you want to invite to the table to talk about how we might be able to assist you in the future. Did you see any other questions in the chat really quick that we need to answer?
I think you've been doing a really good job of covering them, Mary Jane, as you went along.
Okay.
If anyone does have any other questions, please put those in the chat. I can say firsthand, I've had the pleasure of working specifically with Mary Jane on some of the health career exploration programming. AHEC provides phenomenal resources and they're a great partner to work with. So for anyone thinking that this may be something that could help your community, I think it's definitely worth the conversation to see how you might be able to partner with the AHEC program. We do have a poll up here just to kind of figure out if you've any knowledge you've gained today. If you could fill that out, that helps us. Are there any other questions that folks have that you want to put in the chat? I think that there's been a lot of conversation, but getting students back to rural communities, especially students that came from rural communities, is really important. And all of these programs and resources that AHEC has discussed today, they make it as easy as possible for that student to spend time back either in their home community or in another community, rural community across the state, and try to give them that exposure. And they make things as easy as possible with trying to provide housing and meals and all of that. So this really is something that it's important for us to think about students in our lives that might benefit from it, make sure they're aware of it. We do have a question. Do you know how close Illinois is on allowing community health workers to bill for services?
It's a good Mary Jane question.
Yeah, I will say that Medicare is willing and Medicare is pushing states to put legislation in place. So that being said, a lot of places are billing for community health worker services under either care coordination models or chronic care management models. So that's where it is right now. We're waiting for the state to develop the certification process for community health workers. So that'll be the next step in the process. But I think Medicare will be much further along and advanced in billing for those services. Medicare has also had exploratory codes in for health coaching, so health and wellness coaching, and that they're still exploratory, but we anticipate that those will go into full codes in the future, but they have to be connected to a healthcare setting at the moment. And so we're seeing some more about that. But again, we're waiting on the state. There are meetings that you can attend to follow that through the review board for community health workers. And you can also put in public comment on their how they're moving forward. I'll just leave it at that.
Thanks, Mary Jane.
You're welcome.
So we've had some great compliments in the chat. Thank you for your time, ladies. Thanks for sharing with us about all the great work that you're doing and your colleagues around the state. Just as a reminder to everyone, this is the first in a three-part series that we are doing focused on rural health with University of Illinois Extension and Rural Partners. The second webinar will be this Thursday, the 7th at noon, and we'll be talking about maternity care deserts and maternal fetal medicine via telemedicine. And then our third is going to be on Thursday, March 21st at noon, and we'll hear from OSF On Call's digital health leaders and some of the programs that they're offering. So if you have an interest, please sign up for those webinars. We're really glad you took time out of your day to join us, and we hope we'll see you again soon. Thank you.
Thank you all.